you have a set of programs that try to ensure certain patient outcomes. For example, your fall program, the point of that is to minimize patient falls. Hi everyone, my name is Maryam Treystman from the Home Health Consultant, and today we're going to be talking about how the Administrative Compliance Program affects patient care. But first, if you like our content, please like, share, and subscribe. So let's talk about how admin compliance affects patient care. So one of the things that I've heard a lot in the industry is that all of these administrative things are a little BS-y. I've heard this sentiment all over the place that, a lot of it is just like kind of bureaucratic paperwork that we have to do. And on some level, I understand where this comes from. Like, here and there, like if you have a single owner that's the sole GB member, and now they have to do governing body meetings with themselves when they hire themselves as administrator or whatever, things like that. Those kinds of things can feel performative. However, as a whole, the idea of administrative compliance, the whole point of it as a theoretical concept and also in practice, it's a set of activities that aggregates the most critical and relevant information to trickle up to your leadership so that they can make proper decisions about the general company system and program. And then the admin compliance program then further trickles the information from leadership down all the way down to the patient care level. And so at its heart, all the activities that you do in the process of being compliant administratively, meaning like all these programs and meetings and ethics meetings and this committee meeting and whatever, all these things, are for the purpose of identifying and moving the most important information to the places and the people that are going to be making the decisions about the company, and then moving that information down to ensure that it reaches the patient level. This is the point. Prior to all of these regulations and requirements, agencies kind of ran like the wild, wild west. And I probably want to touch on one little another little side note here is that I'm a true believer. And I mean, I'm not unique in this, and this is not some realization I've had that nobody else has in the world. But laws are usually made in response to problems. Like, for example, emergency management as a condition of participation came as a result of the tragedy of Hurricane Katrina in New Orleans, when all the health systems failed, when in the face of this massive natural disaster or whatever, I don't get into that, but in the face of this horrific disaster. From there, we started getting emergency management requirements and conditions. So all of these various laws and regulations that we have in place, they are a result of previous problems that happened in mass, probably nationwide, or maybe they were critical problems that maybe they didn't happen in a million places, but they were so bad when they happened that you had to put something in place for it. Because otherwise, honestly, if there's not a rule for something, you're probably not going to go and sit there and think about it or do it, because there's so many rules you already have to comply to that you're not going to go above and beyond most people past the base set of the 1,000 rules you already have to work around. And so when you are actively and properly trying to run your administrative compliance processes, what you're doing is you're identifying and tracking critical data that's important for your leadership to know and understand, and that's important for you as your company to have an idea of the positive and negative potential patient outcomes that you are having as a result of the treatment being provided. It also includes programs. So programs are just like a set of activities, policies, procedures, whatever, just like, all of the policies, forms, and services, whatever, that are there to achieve a specific goal. You have a set of programs that try to ensure certain patient outcomes. For example, your fall program, the point of that is to minimize patient falls. Why do we care about patient falls? Because there are statistics around when a senior citizen falls, they are likely to have a fall again within the next year. And then that can also trickle into ultimately a death situation because it lowers their self-confidence into walking more. They become less active. They become less resilient to recovering from something like that, whatever. It's a whole thing. Like, there's a lot of information and studies around it, but that's why we work on falls. Infection control. We recently had COVID as the pandemic. Regardless of where you fall on that issue in terms of like its politics and, whatever, like how the performance of certain governments and health organizations for COVID, we saw how quickly and easily a given infection can spread in a community. Like, literally, it was just going like wildfire from person to person, whether the outcome was significant or not or whatever, that's right off the table. My point is, the point of the infection control program is to prevent the spread of infections between staff and patients. Also, you have a required effort for process improvement through QAPI. You have to process improve at least annually through the QAPI program. And additionally, the regulation requires that you priority assess what you are process improving in a certain methodology. And so they want you to address critical health issues first, health and safety. All of these things that are seemingly random and kind of like not really related to each other combine to make your administrative compliance program. And as a result, the failure to do this for real and properly is going to result in bad patient care and bad patient outcomes. Now, you might be thinking, but why? I have the best nurses, they care, my home health aides are great, my bereavement program is fantastic. Yes, great. But without these administrative compliance processes, you are relying on a set of talented, caring, and motivated individuals to do the right thing every time and not skip corners when they're not being observed, which is fine. And I'm sure your entire staff is like that. But if you took a random sampling of like 100 people, it's kind of like the shopping cart theory, right? Like, just think about like what percentage of people return the shopping cart. Recently there was like something that came out that you could tell a good person by like who returns a shopping cart or whatever, because they were saying that the reason that you can tell like if someone's a good person or judge a character based on what they do with their shopping cart is because there's no consequence for not returning the shopping cart. It's just kind of like you're trying to be a good citizen and follow an orderly process. But when you go to the supermarket, you see a million shopping carts in the middle of parking spots, blocking people from parking there, in a random, like up on the curve halfway and things like that. Just next time you're in a parking lot of a supermarket, go count the numbers of returned shopping carts versus the number of unreturned. That is going to be the general breakdown of how much of your staff is going to proactively do their absolute best to follow everything in your company that they think is right, whatever, all this stuff, versus the people that are going to do not like bad stuff, right? But function more on what's the bare minimum I can get away with like, doing a good enough job, but like not putting my full energy into stuff. Like this kind of attitude. And I'm not making a judgment about, obviously you want the staff that's going to like go above and beyond, right? But like I'm not here to like bash this group versus that group. My point is that if you don't have a proper and working administrative compliance program, the group that doesn't return the shopping cart is going to essentially dominate your company, because people who return the shopping cart, that group, they don't typically want to work in environments with people who do bare minimum. Like the group that goes above and beyond, the person that goes above and beyond, the person that coasts on a minimal effort or like cuts a corner when not being looked at, this guy wants to work with this guy because this guy is going to cover this guy's tracks sometimes. This guy wants to only work with people like them because it's less work for them. It's less work. It's less dealing with problems that come up for like things that they didn't do. And so the result of not doing all these things is ultimately going to result in you losing your best people to companies who have got this stuff in order. And of course, it's going to result, obviously, it's going to trickle down to your patient care. And obviously, the government realizes this too, because they have incorporated value-based purchasing into home health. And I'm sure, given the trends of reporting, like now that HIS is becoming hope, they're asking for a more complex set of questions and like outcomes and stuff like that, this will probably ultimately trickle into hospice as well. The value-based purchasing program or requirement, or whatever you want to call it, makes you focus on certain outcomes and then do all these administrative processes around them to ensure that at the patient care level, you're getting specific outcomes. That's it. That can only happen through an administrative compliance, properly functioning program, whether you do it through us, whether you have some other consultant or someone running it, whether your administrator is just really good at it and can do it, whatever. It doesn't matter how you get to like the promised land. The point is that you attempt to get there because it's going to result in every positive outcome in your company. Will it take a little more effort? Yes. Will it maybe require a little bit of money or a little bit of time? Yes. But the effort, time, and money you are putting into this is going to 10x, especially with value-based purchasing, in the profit and lack of problems that you get back from doing this properly. It's kind of like going on a trip with a big group and having no plans. Have you ever done that? Have you ever tried to go to like Disneyland with a big group with no clear leader, no pre-plan about how we're going to go through the park or, any trip? Like no one's in charge. The people in charge are kind of like passive, not really actively in charge. Everyone's just kind of doing their own thing. I have. One time I went on a trip. It was like 20 people to Disneyland, multi-generational, kids, middle age, seniors, everybody. And you know what happened? We went on like 2 rides. When I go with my family, we go on like every single ride because like we get there early. We have our plan of how we go through the park. Like we know what we're doing. Like we've got this down. But then when we went with like 20 people, literally in the walk from one ride to the other, we would make like 6 stops because nobody planned when are we going to the bathroom as a group that everyone tries to go to the bathroom. And at the same time, whoever doesn't can go buy their snacks and whatever. So instead of just going literally walking 1.5 minutes from one ride to the next, or like waiting to be in line in that ride for people to go to the bathroom since you wait an hour plus in every line, literally now that 1.5 minute walk became 45 minutes every time because this person wants to go to the bathroom, this one person out of 20, so now we're all waiting for them. Now I see a snack I like, I'm gonna go get. And so like enough of this, and it was just chaos and we got nothing accomplished. We literally went on like 3 or 4 rides in a 12-hour period. Okay, that's crazy. That is the same as running your business and not paying attention to your admin compliance processes. It is a free-for-all. It's a wild, wild west. You have no idea what's going on. You don't see a problem until it explodes in your face, and you lose all the best people. These are the consequences of not having, or at least not attempting, a proper administrative compliance program. And it could fail your business. And agencies who ultimately grow past a certain level have to get these processes down really tight to get to that level. If you're stuck at a certain number of patients, it's just like no matter what you do, you can't plateau. It's just plateaued. You can't move past it. You need to start tightening up all of your little processes and make sure that they go well, because that is why you can't grow. So that is how your administrative compliance program affects your patient care. Of course, at the Home Health Consultant, our whole business is running a clean and super powerful administrative compliance program that allows you to focus on what's really important, patient care, with expert guidance and all sorts of stuff. If you don't want to use us, please have an active administrator, have anything, but I beg of you, change the mindset of this is just bureaucratic performative stuff, because it's not. If you do this, you'll be 100 times better for it. So my name is Maryam Treystman. We are the Home Health Consultant, and this is how your administrative compliance program affects your patient care. And if you like our content, please like, share, and subscribe.